This is Pnasia medicosis. Today we discuss the diseases of the spinal cord that include Syringomyelia, transverse myelitis, and brown sequard syndrome. In Syringomyelia, there is central cavitation of the spinal cord due to abnormal collection of fluid within the spinal cord parenchyma. The most common associated with Arnold-Chiari malformation. Other causes are post-traumatic, post-infectious, tethered spinal cord, and intramedullary tumors. Clinical features are include most often are asymptomatic and diagnosed on MRI. Symptoms may include bilateral loss of pain and temperature sensation over the shoulder in a cape-like distribution. The tracts which are involved are lateral spinothalamic tract and preservation of touch, thoracic scoliosis and muscle atrophy of the hand may occur. It is diagnosed by MRI. Treatment include depending on the size of syrinx and most often evaluated by neurosurgery. And the second is the brown sequard syndrome, which are a hemisection of the spinal cord. Lesion involving either the right or the left half of the spinal cord, usually at the cervical level, where spinal cord enlarge. Causes include trauma, fractured, stab wound that causes hemisection of spinal cord, or most commonly a crush injury to one side of spinal cord, tumor, and abscess. Clinical features include contralateral loss of pain and temperature. The tract involved is spinothalamic tract, ipsilateral loss of ipsilateral hemiparesis. The tract involved is corticospinal tract and ipsilateral loss of position and vibration sensation. The tract involved is dorsal column, medial lemniscus system, and prognosis for neurologic recovery is very good. The third one is transverse myelitis. This is a rare condition that specifically affects the tract across the horizontal aspect of spinal cord at a given level. The thoracic spine is the most commonly involved. The cause is usually unknown, but it can occur after viral infection. Progression is usually rapid and lead to death. Clinical features include lower extremity weakness or plagia, back pain, sensory deficit below the level of the lesion, and sphincter disturbance, especially urinary retention. MRI with contrast is the imaging study of choice. High-dose steroid therapy is often used, but evidence supporting its use is equivocal. The prognosis is highly variable and unpredictable, ranging from full recovery to death. Following are the diagram for the Syringomyelia and brown sequard syndrome. In A, there is Syringomyelia, collection of abnormal cavities filled with the fluid, and the B is the hemisection of the spinal cord that lead to brown sequard syndrome. This is all about the diseases of the spinal cord, their feature, clinical diagnosis, and the treatment and prognosis.